تفضل. السلام عليكم. السلام ورحمة الله. أهلا وسهلا. يا هلا يلا بارك. تفضل. معك الدكتور معاذ، طبيب نفسية. ممكن تعرفنا عن اسمك الله يعافيك؟
اسمي ظافر.
ظافر؟
نعم.
ونعم والله يا ظافر. كم عمرك يا أستاذ ظافر؟
26 سنة.
26؟
نعم.
عمرك الله إن شاء الله. أستاذ ظافر الله يعافيك، الوظيفة تبعك إيش هي؟
أنا مدرس.
مدرس؟
نعم.
طيب كيف متزوج؟ حالتك الاجتماعية؟
نعم متزوج، عندي 4 أطفال.
ما شاء الله، الله يخليهم لك إن شاء الله. أستاذ ظافر، إيش حاب أساعدك اليوم؟ إيش المشكلة اللي تعانيها؟
صراحة خلال الفترة الماضية أمر بمرحلة غريبة، أول مرة تمر علي يعني. عندي المزاج تغير، مش زي أول صراحة.
سلامتك.
الله يسلمك. يعني فقدت أشياء كثيرة جدا، التركيز وأشياء كثيرة جدا، من ضمنها التركيز بالمدرسة تأثر. المود عندي أصبح سيء جدا، هذه أهم ميزة، أهم صفة أنا ألاحظها حاليا.
متى بدت معك المشكلة؟
تقريبا من شهر.
من شهر؟
نعم من شهر.
هل هي بعد حادثة معينة أو شيء حدث لك؟
بصراحة ما صار لي شيء يعني محدد، ولكن خلال شهر أنا فقدت الرغبة في كل حاجة، يعني أصبح عندي ما أصبح لي مزاج بأي حاجة في الحياة، يعني حتى بالتدريس، بالتعليم، بالوظيفة، بالمنزل. ويعني أصبحت يعني طاقتي يعني منهك يعني بالعربي
يعني ما في أي حدث
لا ما في شيء كذا تغير فجأة.
سلامتك والله يسلمك. كيف أثرت المشكلة على حياتك؟ يعني أثرت على الوظيفة، على النوم؟
بصراحة أثرت بشكل كبير. من ناحية الوظيفة أنا حاليا بإجازة، لأنه فقدت التركيز، فقدت الشغف، فقدت أشياء كثيرة. الطاقة، أصبحت يعني مرهق بشكل يعني أدنى شيء أعمله يكلفني جهد عالي جدا.
أيوة.
هذا
هذا في الوظيفة. طيب في النوم هل أثر على النوم؟
نعم أثر بشكل كبير بالنوم. أنا كنت أنام بشكل طبيعي، وحاليا يعني بنام ساعتين 3 كثير يعني ما نوم سيء.
سلامتك والله، ما تشوف شر إن شاء الله يا رب. طيب في حاجات تحسن من حالتك أو تزيد من حالتك يعني في أشياء معينة؟
نفس المشكلة إذا كنت أواجهها أو أفكر فيها أو إنه أبدأ أفكر، يبدأ عندي يعني المزاج مش جالس يتبع الوضع الطبيعي. فهذه الأشياء اللي تسبب لي يعني تجعلها أسوأ. أما من حالة الأفضل يعني مجالسة الناس الإيجابيين، جلسة مع الأهل قليلا تخفف عني شوي.
عندك مشاكل ثانية تعاني منها مع هذه المشكلة يعني؟
لا الحمد لله ما في شيء.
هل طيب رحت دكاترة قبل عن المشكلة نفسها أو مشكلة من قبل غيرها يعني؟
لا الحمد لله
ما في
حدثت.
ما في أي زيارات صارت؟
ما في زيارات، هذه حدثت حديثا يعني.
طيب عندك أي مشكلة صحية أو نفسية؟
صحيا نفسيا ما في شيء الحمد لله. هذا الوضع اللي أنا أمر فيه الآن حاليا خلال شهر. أما صحيا أنا مصاب يعني بمرض مزمن، شخص مصاب بالسكري.
مرض السكري؟
اي نعم.
سلامتك والله.
سلامك الله.
شوف شر ان شاء الله.
ايش
مؤهلاتك العلميه؟
انا معلم اكيد، عندي بكالوريوس لغه عربيه.
طيب هل انت مرتاح في مجال عملك؟
سابقا نعم ما في اي مشكله سابقا، لكن حاليا لا، انا باجازه حتى اجد حل لمشكلتي.
طيب استاذ ظافر الله يعافيك، ممكن تكلمني عن طفولتك كيف كانت والى الان؟ هل في اي
الطفوله الحمد لله انا تربيت بين اخواني. امي والوالد والوالده كانوا جدا طيبين معنا، ما في اي ضرب، ما في اي تعليم الحمد لله. تربينا على شيء طيب وما في اي مشكله يعني. طفولتي كانت جيده الحمد لله.
كيف كان تقييمك الدراسي؟
التقييم الدراسي قبل التخرج يعني من الجامعة كان ممتاز الحمد لله، ما في أي مشكلة.
ما في مشاكل
أبدا مشاكل في الدراسية ما في مشكلة.
وحاليا وين ساكن؟ مع مين ساكن؟
أنا ساكن بفيلا مع زوجتي وأولادي.
مع زوجتك وأولادك؟
نعم.
طيب معليش يا أستاذ ظافر، في سؤال بسألك إياه ممكن يساعدنا في حل المشكلة وكذا. هو بيكون شخصي ولا راح أحد يعرف الموضوع هذا. هل أنت تدخن؟
إي نعم للأسف.
كنا تدخن؟
أدخن
باكت في اليوم؟
نعم.
طيب بالنسبة للمشاريب الروحانية، هل حاولت تجربها؟ يعني قد جربتها أو شيء أو لجأت إليها؟
بصراحة يا دكتور أنا بجاوبك وأتمنى يكون بيننا يعني
بيننا ما يكون.
للأسف إني جربت. إي نعم الفترة الحالية اللي أنا أمر فيها أحاول إني خبروني يقول إنه بيساعد
وكذا. كم كنت تشرب؟
للأسف
قزازة في اليوم؟
نعم بالضبط.
طيب أستاذ ظافر الله يعافيك، تشتكي من أمراض؟ قلت لي إنك تشتكي من أمراض
نعم.
مزمنة اللي هو
أنا مريض سكري.
أي شخص ما في أي أمراض ثانية عانيت منها؟
لا
الحمد لله.
الحمد لله.
الحمد لله. طيب سويت عمليات قبل؟
عمليات؟ لا
ما سويت يعني؟
ما في عمليات ولا دخلت المستشفى.
طيب عندك أي حساسية من أدوية أو من أكل؟
لا الحمد لله ما أشتكي من شيء.
ما عندك؟
لا.
كيف الأكل معك؟ كيف نفسيتك في الأكل؟
والله شوف، بما أن المود زي ما قلت إنه لود سيء، فتأثر أشياء معه كثير. الشهية انفقدت يعني. الوزن عندي إذا كانت تسأل عنه يا دكتور برضو مع الشهية نزل.
الوزن نزل؟
نعم الوزن
بعد المشكلة
نعم.
ولا؟
نعم مع المشكلة وخلال المشكلة فقدت الشهية، أكيد وزني نزل معه.
كيف تقيم نفسك في علاقاتك الاجتماعية؟
سابقا ممتاز جدا، علاقتي مع أصحابي بالمدرسة بالأصدقائي المقربين أهلي جدا ممتازة. حاليا لا، أنا أفضل الانعزال والوحدة.
عندك أستاذ ظافر روتين معين في حياتك تسويه؟
والله أنا الحمد لله شخص رياضي
ما شاء الله.
فكنت أمشي يوميا لا يقل عن من نص ساعة إلى ساعة. لكن بالوضع الحالي أنا فقدت كل حاجة، فقدت الشغف في أي حاجة أنا أستمتع فيها.
في وقت فراغك وش تحب تسوي؟ في شيء معين تحب تسويه في وقت فراغك؟
مثل ما ذكرت أنا شخص رياضي، في وقت الفراغ كنت يعني مرتين بالأسبوع كنت ألعب كرة. أنا ألعب كرة وكنت ألعب كرة يعني بشكل أسبوعي، ولكن فقدت كل حاجة، الشغف بكل حاجة. أصبحت يعني فاقد الشغف بكل شيء أبدا.
سلامتك.
برضه ما في لا طاقة ولا أي حاجة حتى أعمل شيء في حياتي.
سلامتك والله. طيب تحس تسمع شيء أو تشوف أشياء؟
لا الحمد لله ما وصلت الحمد لله.
طيب كيف علاقتك الجنسية أستاذ ظافر؟
من قبل المشكلة طبيعية.
بعد المشكلة؟
أبدا فقدت هذا الشيء.
فقدتها؟
ابتعدت عن الشيء هذا تماما. فقدت هذا الشيء لا الشغف في كل حاجة أنا فقدته.
والله سلامتك ما تشوف شر أستاذ ظافر.
يسلمك يا دكتور.
طيب حنا بإذن الله أستاذ ظافر بنسوي تحاليل وعلشان نشوف نوصل على التشخيص المعين. تمام. هذا بالنسبة للإجراء اللي بنسويه، وإذا عندك أي استفسار أو شيء حاب تقوله أو تستفسر عنه.
والله دكتور ما في شيء معين، لكن أنا جايك هنا من نفسي يعني. أنا جاي أبحث عن حل المشكلة صراحة، ولكن إن شاء الله
بإذن الله
تحسن يديك إن شاء
بإذن
الله.
الله بإذن الله يعطيك ألف عافية على زيارتك لنا إن شاء الله.
الله يعافيك.
وبإذن الله قدامك ألف عافية.
الله يعافيك يا دكتور. الله يعافيك إن شاء الله. ما قصرت.
أتمنى when you finish just okay shake hands وخليه والأول السلام عليكم. Thank you very much. Okay. Please have a seat. Criticism. Now you are expert today, comparing with yesterday. Okay. Any criticism? Any well? سعيد. See, ما شاء الله. Before later. Okay, for معاذ. ما حد يبغى يفطر الصباح فول ولا غدا ولا عشاء؟
فطرنا قبل دكتور عشان ما
والله العشاء والله انت تكسب يعني كذا رائع ممتاز تكسب حرية كلام. It was really excellent interview. I congratulate you. Okay, it's really nice. He utilized, and this is the way that I would like you to do. P neutral. P yourself. Utilize your own resources or own talents or common sense. I think he did it very well. I like your way. Just his he kept smiling. He kept just really has been close to his patients. Many facilitative techniques. I put some of these things like especially when he talked about, he introduced himself very well, and it was a smooth interview. Okay, I like it, and he took full mark for all the items that we started. He said that Salamat, match of sharp, and so forth, as if you are talking to your neighbor in a really intimate way, you will start to talk like this. In your, whoever, lovely friends. So I felt as if he's a friend. This is the way one should. And see, he is just nodding his head almost. This is an excellent way of, dealing with the things, facilitative, things. في أشياء حقيقة يعني كمان he introduced himself or he prepared his patient. طيب الله يعافيك ممكن تكلمني يعني عن طفولتك. He started الله يعافيك وممكن that's really you need to prepare your patient about these things. So I think he was excellent in these things. When he started to talk about sexual issue, I think if I were him, I will prepare my patient more. He was a little bit direct. How is your كيف علاقتك الجنسية? Direct. It's better again, suicide, sex, psychosis, the sensitive issues. Please work more on them. Prepare your patient better. كيف علاقتك في البيت مع الأهل in general? And then this is the first, that means what? The patient will think about the relationship. And then, no, I'm talking about intimate relationship. So that you ask, just you hit two birds in one stone. You ask about the relationship in general, and then he will tell you about the relationship and this, you can just go more about the sexual intimate relationship. But later on, because he has really good social skills in this thing, so he said, okay, he corrected at the end of that question about this. Again, Matruf Sharp is always his logo. So he has, okay, Matruf, that's excellent. So that means, okay, I'm really, concerned about you. And though it is really faked, situation, it is role playing, but I think this is a model. One should just take it in his practice. Later on, this is good. Just be yourself. Thank you very much. في بطل؟
لك
أنت الشباب. Okay, tell me about your patient.
My patient named Bafir is 26 years old. He's married, has 4 kids. He's complaining of low of mood and low mood and loss of interest since for 1 month ago, and he had sleep disorders and sleep problems and sexual problem, and he had diabetic, and he is loss of appetite, and no effect in his no effect in
Well, anxiety بيطير كل شيء.
أيوة.
You know that, but I'm sure you know that. Okay, go ahead. If you want, you can just even read from some of things from your note. If you took them.
no family history for any disease or no past medical surgery.
Attendance, okay. Come sorry.
And he affected his job.
Okay, the problem affected
Yeah,
his job.
the problem
Try
affected
to
his
make, the full sentence. Don't make abbreviations in your, in your presentation. Okay, go. Okay, you talk about, past history, family history.
past medical history. He's a smoker and he drink alcohol.
It's very important whenever you say you cannot say smoker. You need to specify. If I'm coffee addict, you need to tell me how much. Because I consider myself as a coffee addict if I took, for example, just one small cup. So wrong. You cannot just say that. And the same thing, if I took just one, for example, cigarette, I might consider myself as, no, it is not like this. Or again, the same things as alcohol. So you need, whenever you ask about any specifically, substance, you need to specify how frequent is it, social drinking or social whatever. Do you have any, we will come to the addiction later. You need to ask some question immediately whenever you have depression, for example, you have 1, 2, 3, 4, 5. You should ask about. This is as if this is just what I mean. You don't want to disturb the addiction. Whenever you have substance abuse, you need to go for certain areas. I will come to that addiction better than I would like to see their performance. Go ahead.
And he smoked 1 pocket in 1 day, and for
Oh, that's good.
for alcohol, he's drink 1 bottle 1 day.
He
Daily.
used to drink. He used to. That means simple past tense. Okay.
And for
Five S's. Reach
Five.
5 S's.
for sexuals, he affect the sexuals, and for
You need to say that this is not, imagine that you are. So in what way he was affected or the sex was affected? You need to give me a comprehensive, understandable sentence. So the conditions affected his sexual performance. Come on. or his sex. Now, I didn't understand. Nobody, I think, in the room could understand what sort of sex was affected. Is it the desire? You know, the sex has more than one thing. Or is it the performance? Or, well, so you need to specify more. The frequency, many of these things should be specified. Whenever you say something about, please link some, you know, list. A list of a query should be linked to some symptoms. Whenever you ask about sex, immediately you should just, okay, sex, that means 1, 2, 3, 4, 5, as if it is drop down menu. Well, sleep, 1, 2, 3, psychosis, 1, 2, 3, whatever, okay? So just immediately, drugs, 1, 2, 3. So please try to make your own list. Whenever you have pain, I noticed that, or yesterday it was really excellent for Abdullah, when he asked about appetite, I think he said, no, there is no appetite, or I cannot remember, but immediately, again, run the drop down list. Have you تذكر ايش سألته؟ Okay, I know that. He asked about his weight. So whenever you ask about appetite, you need to ask about weight. You know what? To know the severity, how severe, how big is this a problem? Okay? So we ask about, you know, sex. We ask about severity. Sleep.
suicide.
Did you ask about suicide? What is it? Okay. This is the game I like to play. What is the diagnosis so far? What is your provision diagnosis so far?
Major depression.
Major depression. Thank you very much. That means you have this sense that this patient is depressed.
Yes.
Depression, you cannot ignore this. Other than that, they will tell you that you are not safe psychiatrist. Depression, alcohol, oh my goodness. That means immediately suicide, right?
Yes.
Okay, so this is why try, please book, put this list, psychiatry, these 5 S's, please. History of present illness, that means start now, and well, what is the accompanied symptoms or review of the symptoms. So please try to make a list, many lists in your mind that will make life easy for you. Okay, طيب كمل. خلصنا طبعا suicide. في another S which is psychosis. Did you ask? No, you asked. You told him.
Yes, I told him about
تسمع أصوات.
تسمع أصوات.
Please be careful about how to ask psychosis again. Again, psychosis means one of the sensitive issues. You need to prepare sensitive issues. That means you need to prepare your patient well. So he asked him directly, وهو مشاله إياها طبعا because of role play. تسمع أشياء؟ لا ما أسمع. This is طبعا لا السؤال صحيح ولا الجواب صحيح. How you ask about psychosis?
تسمع أشياء أو تشوف أشياء إحنا نشوفها أو كذا.
أنا والله أسمع أشياء والشباب كلهم يسمعوا أشياء. أنت تسمع أشياء.
بس في أحد يقول هذه الأشياء ولا ما في أحد؟ يعني في مصدر.
أنا أسمع أشياء الآن واحد يقولها هو أنت.
في مصدر يعني.
أيوه في مصدر. But this is why I told you, you asked him, he might deceive you, anybody. As I don't know if I told you that. I used to just joke with my, colleagues. If they are just in front of me and just walking and I call his name. So he will, well,
تسمع أصوات ما حتسمعها غيرك.
Thank you very much. This is the idea. Yesterday before I was with my, with my niece, and she could have. You need to apply. I know this is why the knowledge. Okay, now we are dealing with the skills. So she told me I just talked to my cat, and she enjoyed talking to the cat. I said, okay, that's excellent. Does your cat talk to you? She said she smiled. I told her, whenever you start to hear, your cat talking to you, please come to me. Okay, come in. So psychosis is, please, the idea is you might ask anybody, do you have waswas? Yes. He doesn't know what do you mean by waswas. And you cannot rely on his answer. It is not reliable. I cannot rely, yes, waswas. Well, what does he mean? إيش المصطلح? What do I mean by waswas? What do I mean by psychosis? تسمع أصوات? Yes. Do you have depression? Yes, I have. But of course, no. I'm talking about something that's more specific. This is why we are scientists. You are scientists. Don't forget your role. You are scientists. Scientist means you are responsible in front of Allah subhanahu wa ta'ala that yes, you should witness the right things. Okay. Tell me about the mental state. Okay.
about mental state.
في شيء آخر positive. Okay.
About mental state.
طبعا في positive لكن very important issue. You asked him and he told you that yes, I have. طبعا I will.
Diabetes.
Thank you very much. Yes, diabetes. He is diabetic, and that will make sense. So there is a medical problem, and he is depressed now. So you can link things together. Okay, mental state.
Regarding to the appearance, his reasonable dress,
Reasonably
dress, and no good smell, not bad smell.
No smell.
No smell.
Okay. You can say if you want to say that, well, he had good, for example, perfume smell. But if he doesn't have, don't say it. That means the negative things we are looking for. Is he alcoholic? This is why the alcohol smell. Or he is dirty. I expect a person with depression to be dirty, not taking bath for a long time. This is what I'm now draw the picture of depression. Put something here, something there, and then you have excellent picture of depression. Okay? So forget about smelling. If he is not smelly, don't say it. Or you can say he's not smelly.
It's not smell. Okay. Regarding to the effect, he was depressed and.
خلصت الappearance. It is a rich appearance, and thank you very much. He did excellent. Describe more.
appearance.
Now, I think all of you expert in mental state examination. All of you should know what is murmur, for example, what is crepitations, what is. So, can you add what is the mental state of Saeed? Just give me one thing.
Good hygiene. Good hygiene.
Good hygiene, okay, he said it. Okay, he said that reasonably dressed. Any other person?
He had low mood.
Low mood, he said affect is okay. No, appearance. We are talking about appearance.
No eye contact.
Thank you very much. No, خليها بس تعودها. please put it down. No eye to eye contact. بلاش no.
Avoid himself.
He was avoiding, thank you very much, avoiding eye to eye contact. And eye to eye, because he had good eye to, floor contact. People, they miss these things. This is why I told you, please write it down. Eye to eye. So he's avoiding the eyes of Muaz. He doesn't, and was excellent. This is excellence, they call it. The other name is downcast gaze. Gaze means, تحديق. Like, there's just, you are just keeping, you're looking at a person, this is gaze. Downcast gaze. That's when you say downcast gaze, almost diagnostic of depression. And for a long time, it just looking. So this is why, please be careful. Describe what you see. Okay, smell. Okay, that's good. He's not smelly. He is reasonably dressed. And then what about his, other side of these things?
Blue forest tone.
We are talking about just the appearance. Yeah, thank you very much. تفضل.
He's well groomed. Well groomed.
Well, he is reasonably. لو كان حاطط جل ومطبق اموره سبايكي or whatever.
مشرب كويس.
شكله هيغطيك. تفضل.
الدكتور اللي avoid eye contact كمان المفروض أولى في البيهيفير. ولا لا أولى في الابيرنس.
لا, he just you are describing what is going on. You have a point, I understand. The Hassan ولا Hassan, by the way? Hassan. Why you write your name with 2 S's? Anyhow, now you are describing. Yani this is the picture. If you want to draw, you can just draw a picture, even no behavior. That you are describing the picture. The picture is downcast gaze. Okay, come. So we finished affect. He is depressed. And if he is crying, please mention that. Say he is tearful. The best description is tearful. One day during my residency program, I wrote big list in appearance, big list. What should I describe in the appearance? What should I describe? Just vocabulary, okay? The vocabulary, please try, you need it. Later on, even the beauty of psychiatry, it will give you, just you look that you are educated. You use vocabulary. Usually people look at you even if you are doing IELTS or whatever English, TOEFL, or they assess your vocabulary. And if you are educated, any psychological term, people will say, wow, he is really educated. This is why I really advise you just to enrich your psychological term and vocabulary. You will feel more confident. You feel that you can utilize describing whatever in front of your eyes. This is why really people who understand psychiatry, psychology, sociology, they utilize terms, people they admire, okay? So just put a list. I think I distributed some vocabularies about affect, anger, disgust, and you can just go to the list with faces. Anyhow, Kamil. So we finished appearance and affect.
According to the effects, he was depressed and anhedonia.
انت ما عندك حسين الالعاب، انا ما سمعت الالعاب.
ظن الالعاب.
خلاص راح. Okay, just please tell it.
Regarding to the mood,
لو شفتك بعد 10 سنوات حصل لك اياها.
regarding to the effect, it was depressed and anhedonia. Regarding regarding to the behavior, he was hypoactive.
Yes.
Yeah. And regarding to the
Mention the negative thing. That means he was not aggressive. He was.
he's not,
Yeah.
he was not
He was cooperative.
yeah.
Yeah. He was, and he is, as we said, hypoactive. Yes, you are. Thank you. And Mr. Ashway.
Okay, regarding to the
Two A's.
Two.
B's.
behavioral
We have the behavior, and the other one is the perception.
Perceptions was normal perception.
You said no abnormal.
No
Better than say
abnormalities.
normal.
Yeah.
Because sometimes they, well, do you have hallucination or whatever? You reach to that. Well, he denied having hallucination, but he might have it. This is the proper word, is he denied. He said, "أنا ما أسمع أصوات." You told him properly, you asked him properly that, well, this is the question. He hears voices nobody can hear. So that means he might have it, like he doesn't want to tell you. This is why he denied having hallucination. Okay. طيب كمل على طول. Yes, you're right. What we have C and C.
Regarding to the C communications was low tone and slow flow.
Just like beside your name, why I gave you words. Okay.
Low tone, slow flow.
Okay.
Regarding to the cognition, no abnormality for cognitions.
Cognition. Do you remember the cognition?
Yeah.
That means
Thought.
thought. We have two types of thoughts, formal and content. Actually, let me just exhaust this, the mental state, maybe I will not repeat it. Don't forget the pyramid. When you are talking, assess my thought, you should assess two things. The form of my thoughts and the content of my thoughts. Okay, like al-qitar. Okay, the train could be, you should just describe the color of the train, how many cars, and then what inside this cars, right? Okay, that means there is no formal thought disorder?
No.
Okay. The other things. مع depression نتكلم على الكوجنيشن. ايش ممكن؟ يعني what you are looking for في الكوجنيشن. What you are looking for. You are looking for formal خلصنا منها. That means no flight of ideas, no circumstantialities, no thought of what. Just at least just the main thing that I give you. The other thing is أيوة. Is the other part of the cognition is
Orientation.
orientation is the third part. But what the content, thought disorder, you forgot.
Poverty.
Poverty.
Suicide.
The most important thing is delusion. Okay? You need to make sure, especially with depression, usually people, they might have delusions. Do you know? Okay, and this is, if you don't know, I will just give it to other people. Do you know what is the sort of delusion?
The sort.
What type of delusions? Grandiose delusions, for example? No. Usually there is no grandiosity. Grandiose delusion will be in manias. They feel that I'm a king, I am whatever, I am an Mahdi. This is the grandiosity. What do you expect? What sort of delusion? Yes, people who you didn't take. Okay.
I took a bonus yesterday.
Yes, yesterday you took one bonus. Now you have another chance.
Perceptory.
Persecutory delusion, that's great. And another one. Okay, please.
Delusion of self-guilt. Delusion of self-guilt.
Delusion of guilty. Yes, that means he feels that I'm guilty for sure. Thank you very much. Yeah, please give them the bonus, both of them. عشان الوقت, you didn't ask about orientation, right?
Yes.
Okay, you can say that. How you can just escape from this?
He oriented, but
He looked.
he looked oriented, but didn't.
Okay. What is your diagnosis? Is a major affective disorder. How will you treat this patient? Before treatment, what is the investigation you will do?
For him, I would do a thyroid function test
Why?
because if he have a hypothyroid, that will have depression.
So you expect he might have.
Hypothyroidism.
So one of the differential diagnosis is hypothyroidism, and you need to understand that very well. Please, all of you, don't like yesterday. مين وينهم معاذ الثاني. Okay. He mentioned something that MI, myocardial infarction, for I don't know the case. Your case, yeah, chest pain. Okay. So please don't forget, we are doctors. Even if you are dealing, so you should understand that this is a manifestation of, yes, psychiatric problems, but could be physical. Myocardial infarction, and here hypothyroidism. Okay, that's good. How to treat this patient? What is the investigation you will do more?
I will do urine analysis.
Urine analysis. Thank you very much for the drugs. Excellent.
And also we do CBC for maybe he have anemia.
لكن هل في clue for anemia? Don't say it. If you, I will accept it. If you just, please look up, okay, yes, خلاص. And then you told me I will do CBC, yes, understand, that makes sense. So just give me a clue that I'm smart enough, this is why so I think that is bail. So that makes sense. Okay, how to treat this patient?
For him, I will give him Dr. Citalopram.
10
10 milligrams.
You need, by the way, you need to explain to him. This is one of the, the things that's very important. You did not. You need to explain to him, I will give you this medication, and this is the name of the medication, and the things that, تعرف الأشياء الأخرى.
بعدها دكتور الإفكت حق
The side effects and the duration, the time, when it will start.
بس متى أقول له دكتور بعد
When you, ورايح عندك, جاء عندك عشان تعطي. هو في عيادتك الآن. فهو جاء عندك عشان تعطيه دواء. You are prescribed. Okay, I will give you this medication. I will just tell you a few words about this medication. This medication is so and so, it started its effects and this one. تفضل يا اشرح مشي؟ اوكي. في شيء آخر حتسويه؟
I will follow by psychosocial rule. For bio, I will give him a step 1. For self, I will give him cognitive behavior therapy.
Cognitive behavioral therapy.
For social, I will advise his wife or him. That's all.
You need to educate his peers, his caregivers, wife or whoever. Thank you very much. When you will see him?
After one week.
Okay, next.